Welcome, everyone. Thank you so much for joining us today. I'm Alisyn Camerota. I'm the anchor of CNN's afternoon news program called Newsroom, which airs from 2 to 4 p.m. on the East Coast. And I'm so excited to have this conversation with all of you today. But I want to start with one overarching question for everyone today. And that is, how well is the world? And I know that that's a loaded question, especially, of course, in the face of a global pandemic. But unfortunately, as we're about to hear, if the world were a patient, the prognosis would be bleak right now. Here are some very sobering statistics. According to the Gates Goalkeepers Report from 2020, the pandemic has set us back in a very big way. The UN's 2030 Sustainable Development Goal for health and well-being has been set back by 25 years because of the pandemic. So COVID-19 has halted and even reversed some global health progress, exposing millions of people to the risk of deadly disease and poverty. Half of the world does not have access to basic and essential health services. More than 30% of the world's population is estimated to be undernourished. Listen to this. The life expectancy of people in low-income communities is 18 years lower than in high-income communities, okay? 18 years. Women and children are suffering the most, and malnutrition and undernutrition account for 45% of deaths in children under 5, and that number has increased for the first time in decades. So obviously all of that is really troubling. But collectively, we can make a difference, and that's what we're here to do today and what we're talking about today. So joining me now are Daniella Foster. She's the Global Vice President and Head of Public Affairs, Science, and Sustainability for Bayer's Consumer Health Division. We also have Lisa Waddell, Chief Medical Officer of the CDC Foundation, Maraniki Fajamising, the CEO and co-founder of Whispa, which is a mobile app that provides young people with private, even anonymous, access to sexual and reproductive health information, products, and services. And we have Dr. Scott Ratzin from Business Partners to Convince. Okay, so first let's just talk about those statistics and where we are today. So Lisa, let's start with you. The statistics that I just read out are jaw-dropping. How did the pandemic set the world back by 25 years?
Well, first, hello, Alisyn. It is great to represent the CDC Foundation and to join all of you for this really important conversation today. As you indicated, Alisyn, these are jaw-dropping statistics. In fact, they are startling and they are disturbing. And I think it's important that we acknowledge that there are people behind all of these numbers. They're children and women and men and families and communities. So, just in 20 short months, to have this kind of setback is really concerning, and it's really a hard pill to swallow, but really an important question that we have to explore. So I'm glad we're having this conversation today. I think there are a number of things that have contributed to this. I think first, the pandemic created a situation in which, individuals had to delay care. They delayed, sick care. They delayed preventive services, and they delayed, just care. So you had people with pre-existing conditions such as hypertension and diabetes and heart disease who didn't go in for some of those routine kinds of visits, and some of those underlying conditions may not have been well managed. And then preventive services, your mammograms, your prostate cancer screenings, your colonoscopies, and all of your immunizations, that's for early detection, right? And for allowing people to get intervention early. And all of those things were delayed. And then you had a situation where people were afraid to go into the hospitals, afraid to go into their doctor's offices for potentially being exposed. So again, they didn't go in. You had a healthcare system that had to divert a lot of its services to care for people with COVID. And so that created some challenging dynamics. But I think it's really more complex than some of that. I think the reality is that we had these underlying structures and systems and policies that created environments over time in which many people who were really impacted by COVID actually were impacted even greater. So they were the ones who maybe still had to go in. They couldn't work remote, so they had to go into jobs. They didn't have health insurance. So it was harder for them to maybe to get access to some of the services. They were living in multi-generational housing. And so when you talked about isolation and quarantine, that was very difficult. So many people in that family were impacted. They certainly weren't able to access the preventive services. And for the children, many families may have lost their jobs. And you talk about food insecurity. And so those situations potentially got worse. The children had, social kinds of challenges. So there were so many complexities and things that contributed to this. But certainly, I think the lack of easy access in certain communities, the policies that were not necessarily supportive of those who needed the services the most, the deferring of care, and many of the complex social underlying social issues all have contributed to the situation that we have. And quite frankly, it shouldn't have been a surprise because these things have existed for years. So we've got a lot of work to do to turn that around. And this is the opportunity because we saw what happened. And so we can do better overall as a country and a world.
You make such a great point, Lisa. I mean, it just basically exposed, as you say, the problems that already existed, but it exposed them in a very acute way. And so, I mean, I'm sure that we all have our own story about how the pandemic has affected our well-being and mental health. But what you're saying is that the most vulnerable and disadvantaged got hit the hardest. And so, Morenike, let's talk about your organization, WISPA. And I know it's on the ground around the world. So tell us just first what your organization does, but then also what you've seen on the ground around the world. Oh, I'm having a hard time hearing you, Morenike. Hold on a second. Is your audio on?
Hi. Yes.
Oh, hi. That's better. Fantastic.
Okay, so Morenike, I'm the founder of WISPA Health, and what WISPA sought out to do and still does is to make it possible for everyone, but mostly young people and young women, if we're going to be very specific, to access sexual health care. In many societies, sexual health care isn't being prioritized. It's not seen as important as other aspects of healthcare. So we make it possible by providing information, by making it easy to access the products they need or to get the services they need. So we're talking contraception, what's it called, STD prevention, STD treatments, as well as even just access to doctors. So being able to ask those intimate questions without anybody judging you for it. So back to the original question. When it comes to the pandemic has altered the lives of young, low-income people in particular. So let's look at the supply chain. Cost of things have gone up. These are people who were struggling to access these services even when they were affordable. And in Nigeria, for example, we pay out of pocket for everything. There is some form of health insurance, but you'll be surprised how much of our health insurance system, and this is within those who can afford private health insurance, many of those HMOs do not actually cover sexual health services. So you can't pay for contraception with your health insurance, assuming you even have it. So we're looking at people who are paying out of pocket pre-pandemic, some of whom couldn't afford it and had to go to only maybe places where they could get it for free. Now, post-pandemic, those costs have more than doubled because most of these products are imported. So when the foreign exchange rates go up, when the supply chain gets stiffer, the costs of accessing care have become frightening. So it became a challenge for us to continue to find partners that were committed to, even if it meant taking cuts off their own profits, to reducing and, or how will I put it, to ensuring that the supply chain stayed affordable when it came to sexual health care. So you want to be there for people when they are pregnant, but how about those who don't want to get pregnant? How about stopping that flow in the first place and ensuring that someone who isn't ready to be a mother, for example, doesn't have to wait till, they are actually pregnant. So it's it's that's effect, for example. So in terms of the supply chain, in terms of financial capability, the pandemic has hit everyone in Nigeria and a lot of African countries. It's hit us very, very hard. Now, in terms of on the flip side, there has been a positive, if I want to be honest. The pandemic has increased the use of digital care. So it's actually, like Dr. Lisa mentioned, people who are scared to go into the hospital and who typically would have been skeptics when it comes to, oh, why should I speak to a doctor online? And this was true even amongst young people. We've seen an upsurge in people actually having those consultations with the doctors online. So this was interesting because we launched mid-pandemic. And so seeing that uptake, that actual usage, and seeing it sustained even as at least in Nigeria, for example, as the weight of the pandemic has kind of lessened, is a positive that has sort of come out of what is obviously a very bad situation that is the pandemic. So I'm giving both sides of this, of the coin, so to say.
I appreciate the silver lining that I know we're all looking for, and I appreciate that it wasn't all bleak and that there were some upsides. But I think that one of the things that I hear you saying is that, and this is the reality of our healthcare everywhere. I mean, not just obviously Nigeria or places like that. It's that our healthcare system, I think, is built to treat sick people, and it's not as good at helping people stay well or before they get sick. And so, very quickly, what are the seeds that need to be planted to change that?
Okay. So the interesting thing about a lot of developing countries is the pandemic has tested and exposed a lot of the weaknesses in the system. One key weakness being that when it comes to, I would say, secondary healthcare, our systems aren't very efficient at handling it. In many places, there just isn't enough equipment. There just isn't enough specialists. When it comes to primary healthcare, on the other hand, we have been very efficient at, sort of ensuring that there's enough primary healthcare centers around the country, around different places, but it's even tested those systems as well. So whether it's shortages in hand gloves or in, protective gear, whether it's simply in people waiting longer than, and these are people who were waiting a long time in the first place to access care. Now they're having longer waiting hours. It's tested those systems, but even more, it's exposed how inadequate some of the secondary healthcare systems are. So not enough oxygen tanks in many places, ICUs. I mean, it's nice to say that word, but these are facilities that were few and far between pre-pandemic. So having a surge of people requesting for those facilities has more or less, made some of them overstretched even beyond the kind of ways it's described, say, in the US. We are talking, they can't cope. Those systems will break down, simply put. So it's important that we start kind of changing the lens and improving even whatever we're doing in the preventive health space. That's one thing that I would say we achieve a lot in my organization through sex education, through the ease that comes from digitizing some of those processes. Yeah. So if that helps, yeah.
Well, it helps a lot, and I hear you, and I think that you've laid it out really well. The whole thing about filthy gloves. We just did this story on CNN this week that these filthy medical gloves are in the supply chain. I mean, it's just that's just one example of how something has gone, horribly wrong, and it's been exposed by taxing the system as we have these past 20 months. Okay, so let's move on to what needs to change and how. So Daniella, let me get to you, because one of the things that we're hearing is that this is all of our responsibility. There's a collective social responsibility to help people take better care of themselves. It's not charity that ends up working for all of us when everyone is healthier. So obviously we talk a lot about self-care, but I'd like your help in defining that, because I think that it's a relative term. based, of course, on where you live. It's open to interpretation. For some of us, we've talked about how self-care is, a bubble bath and yoga. But that's not the case in, every country. So tell us how you define it and how the World Health Organization defines self-care.
Yeah, thanks, Alisyn, and welcome everyone. Look, I think this is a really critical conversation, especially right now. So as you mentioned, I mean, self-care has a lot of definitions, right? But the World Health Organization actually defines it as the ability to take care of your own health with or without the help of a doctor, right? So really, when we're talking about self-care, we're talking about your personal health. And this includes the many things that we may do to prevent disease, to maintain our health, like healthy eating, exercising, taking vitamins, wearing sunscreen. It's also how you may treat a mild illness like a cold with rest and possibly an over-the-counter medication. It could also be how you're tracking your health, right? So fitness trackers are another thing. We talked a bit about digital health, right? And even I have a fitness tracker on today. So I think we can all agree that the pandemic really put the importance of self-care in perspective. So before the pandemic, most people really didn't put the same stock in the care we give ourselves at home to prevent and to treat illness. But the pandemic has empowered people. And this is also an opportunity. If you think about it, there are more than 525,000 minutes in a year, and we probably only spend 60 to 120 of those with a doctor every year. And that's probably in a good year. The rest of the time, we're really spending this time taking care of ourselves. So it's critical that we know how to do so. And this is especially important in underserved communities. So you mentioned, right, half of the world's population doesn't have access to basic and essential health services. And in these health deserts, basically, where people don't have access to a doctor or to a hospital, self-care is really, it becomes their lifeline. It could be their first and only lifeline to healthcare. So it's really critical that we start putting more emphasis on empowering and equipping people to take care of themselves and really expanding access to personal health so more people have the opportunity for better health. So if you think about what we talked about in the definition, recently the Global Self-Care Federation, supported by the World Health Organization, unveiled a new report called the Global Self-Care Readiness Index. And it's really focused on helping both developing and developed countries better understand and create an actionable plan for how self-care can become a part of that healthcare continuum. And we've talked a lot about preventative health, right? We really need to transition towards a full continuum of care. And one of the things that was already brought up that I think is critical is health literacy. And that was a big theme in the self-care report. So it's critical that we have credible, consistent sources of information that are aligned with healthcare providers. Education, it's often an overlooked aspect of healthcare. It's not as sexy as some of the other things we see, but it's critical. It's absolutely critical. And if you consider the health education efforts behind just COVID-19 hand washing best practices, they were orchestrated, they were focused, they were simple to implement, so people did them. So there's a lot of information out there, but it's not always accurate or beneficial. And we know that 2/3 of Americans are often hearing conflicting medical information from friends and families. And this needs to change, right? So in order for people to really feel empowered, for them to start to be confident in their ability to take the right actions, health education is going to be critical in that. We also see that the index has looked at the role health policy and the regulatory landscape play in helping people to take health ownership. And again, some of these solutions, they don't sound sexy, but they're really critical. We need, when we think about policy, to look at new approaches to behavior change, especially when we're determining investments in health promotion and prevention and in self-care initiatives. We need to really develop a whole of government approach to self-care. So think about your community, your local, your state, your federal governments, all working together to both educate and transition towards, positive habits and behavioral change. And this is, again, similar to what we saw around hygiene and social distancing, but we need this in a sustained effort over time. So, for example, we launched a program in our consumer health division at Bayer that really sort of embodies this idea of the self-care readiness index. So in February, we launched the Nutrient Gap Initiative, and the focus was on expanding access to vitamins and minerals for 50 million people annually worldwide by 2030. And we do that by working in partnerships with local NGOs, with governments, really working across sectors. And two of the most important elements of this program are really working to create that health education in partnership with the nutrition community, right? What is that nutrition curriculum? And partnering with leading NGOs to support a whole global movement around maternal health. So this whole partnership and collective action piece is really important. And if we think about that, we saw a really important first step actually just in the last month when the World Health Organization added multiple micronutrient supplementation to their list of essential medicines. So more people are going to have access to this, which is critical. But it's these types of public-private partnerships and collective action that really get us on the path towards positive change.
I'm going to tell a little story, and Daniella, give you a moment to adjust your lighting, because I think that you need to sort of shut your shades because the light is coming in a little unevenly. But my personal story, connected to what you look perfect there, to what you're talking about, is that I had premature twins. So I gave birth at 31 weeks. One twin was 3 pounds, 15 ounces, and the other was 2 pounds, 7 ounces. And so I'm very, my antenna goes up when I hear, you talk about sort of prenatal care and care for, moms. I was told at that time, this was 17 years ago, to take mega doses of folic acid. So 10 times what it says on the bottle. But it sounds like what you're saying, Daniella, is that modern medicine has changed in the past 17 years and that there's actually new treatments that could help with things like that.
Yeah, so I mean, we know that nutrition is critical. The first 1,000 days of life are also critical, and multiple, micronutrient supplementation. It has significant health benefits, especially when you compare it to iron and folic acid supplementation, and it has benefits in reducing the risk of stillbirth, low and very low birth rates. For, from small gestational age births and preterm births. It's also a huge milestone in terms of making these solutions cost effective, so that you have cost effective interventions that are accessible to pregnant women, particularly in low and middle income countries, where we heard at the top, it's many women and children who are being disproportionately impacted by the effects of COVID, right? So we want more infants to survive. We want fewer babies to be born with birth defects. We really want to give every child the best start in life. So this is where I think the power of public-private partnerships, health education, and having clear blueprints is critical. So I think we're certainly taking positive steps forward, and there's also so much more that can be done. And each of us really has a role to play here too.
So Lisa, let me bring you in on that, because, we have heard we've heard these pockets of preventative care and these positive steps, as Marineke and Daniella just laid out, but how do we turn that into a real movement?
It's really important that we do work collectively, and it's that collective action that can really make a significant difference. And so much of this is, how do we engage the community? How do we engage these trusted messengers, these trusted voices? How do we arm them with all of the information? How do we make sure that it's available in a way in which they understand? How do we listen to them and hear what are their concerns? And then how do we infuse then, again, making sure that everyone understands what are those best practices, and that it's okay to put yourself first. It's okay to carve out that time for self-care. And in fact, it can be life-saving. And it's really important. And how do we mobilize together? And guess what? Your voices are so important, and your voices are really powerful. And you can come together to help move and advocate for the kinds of policies and systems changes that may make that environment in which you and many others in your communities are living. So if you don't have safe walking facilities in your communities, if the lighting's not there for you, if you can't access care because the transportation routes don't come near you, how do we mobilize and create that movement together that helps to facilitate some of those policy changes? And I think that what we've seen happen during COVID too, when folks were saying, I'm not getting the information, no one's coming into my communities and bringing the services, then a lot has changed when we hear these voices. And so there's more of that we can do. But I think the other is to try to continue to push people towards where there are information and their programs. At the CDC Foundation, we have been supporting CDC with the Million Hearts initiative to reduce heart disease and strokes by 1 million cases. We have an initiative called, and with that Million Hearts, I think it's important. It's about small steps. What are those small steps that you can do that can really make a significant difference? Make that appointment, get that blood pressure checked, go into the doctor. Those small things really can make a big difference. We have an initiative that we've worked with CDC around Hear Her, just talking about what's happening with mothers and preterm births and maternal mortality and maternal morbidity, mothers that are dying unnecessarily from childbirth and suffering consequences. So the whole Hear Her campaign is just that. Hear me, listen to me. I know my body. I'm having these challenges. Don't blow me off. Listen to what I'm saying and help me to address those issues. And then the piece around mental health is, as we all know, has been a challenge right now. Some of what may have contributed to the pandemic too is that people have been under so much stress. And so they, may have started smoking more, drinking more, using illicit drugs. And so this whole piece around mental health is really important. And we have an initiative that we've worked with CDC also on around How Right Now, around mental health. So there are resources out there. But I think empowering people and helping them to know that when we come together, your voices really do matter and you can make a difference. And we've seen where that happens.
Yeah. Scott, I haven't meant to be ignoring you. I just wanted to get to all of those points first, but I see you nodding along. So what's resonating with you?
Oh, absolutely, Alisyn. And let me thank the colleagues for such a great presentation to make it simple for me to say, how do we package all of these ideas and put them in action? And I think you started this very well, Alisyn, when you asked the question, how well is the world? And how well are we even in the United States or wherever we are? Our countries are not in the best place, partly because of COVID, but partly because of the underinvestment and really what we've been speaking about today. So I answered that question initially by saying we were on the right track. By 2030, we have global goals, sustainable development goals. And in those goals, one of them is partnerships to reach the goals. So we have a new openness in getting all sectors engaged. And for the last number of years, both at Harvard Kennedy School and now at the CUNY Graduate School of Public Health, been looking at multi-sectoral engagement, of engaging the community, the localities, the individuals, and build from both the bottom up, but also have the top-down opportunities. And I think that Daniella mentioned it so well when she said what we need is health literacy. And we talked about a whole slew of different ideas of numbers here. What do I need to do to stay healthy? What do I need to do to get better when I'm sick? How do I live with disease or disability? And how do I have good mental health? That's really the fundamentals of one, health literacy, but we can't put it all on the individual. The system has to make it easier with less demands and complexity for all of us to attain that. And I think that would be the question of how well is the world. And having worked in women and children's health with the Every Woman, Every Child initiative with the UN Secretary General and others, We, unfortunately, have put a number of areas in the United States, we're not even in the top 20 on infant and maternal mortality, where you would think that would be, with the system that spends the most for GDP in the world, there's an issue. So a lot of these activities have great potential. And I think what we've mentioned here today, what Dr. Waddell said, the work with the Million Hearts and the others, if we know our numbers, if we learn the importance of blood pressure, cholesterol, blood sugar, as well as nutrition that's been mentioned, of course, already, stop smoking, exercise, and now add a couple of other things. We mentioned cancer screenings, those changed, but we know we get those from physicians. But more importantly than ever is vaccination. And vaccination, not only, of course, with COVID, which is key and fundamental, but also other seasonal vaccination and childhood vaccination. And let me finally say, it's been mentioned, hand washing. The World Hand Washing Initiative started many years ago by a company, and then the world has got around it. And we made a big step forward in terms of hand washing. A lot of the work, if I can even highlight Miriam Sidibe, who talks about brands on a mission and how the private sector can drive great health behavior change. But we also have the challenge with this. This has become a symbol rather than a way to protect against disease. And we have to be careful that everything that we talked about doesn't get marginalized in society. And I think we can do that by working together. And again, I commend Daniella, the work of Bayer. Great to hear about WISPA and others, that we really have opportunities now. And if the self-care index, the readiness index, gets us motivated, if that's what it takes to get our politicians and leaders, great. But we also need to do this with companies, and we need to have the place with what we've done with business partners to convince people. Wonder what that stands for. We have been working with the U.S. Council for International Business Foundation to develop sustainable development opportunities for building big public-private partnerships. And Convince was the partnership to deal with vaccination, because we know that that's what's important for the resilience and getting us back to where we ought to be. So in the end, if I can say, I think the world is getting better. I'm hoping we didn't lose the 2 decades. I'm really worried that we are, but I'm always an optimist that we have the opportunity, even a conversation such as this. And Alisyn, thank you for sharing your personal stories, and I see you frequently, not as direct. So it's wonderful that you're sharing your expertise today.
Thank you. Thanks. I'm so happy to be a part of this. I mean, I've already learned so much just from talking to you, from researching this. It really has allowed me to see self-care through a different lens than I had a week ago. And so Marinike, I think Scott did a great job at the 30,000-foot view of where we are and what we need, but you're on the ground, with WISPA, and you're talking to women and girls on the ground. And so what do we need to know about what's happening in different villages and pockets around the world?
Okay. So thank you for saying something you said, Scott, about hand washing. It reminds me of a photo I saw last year. And it brings home how people are even more conscious now about their hygiene. So there was a bus park in Rwanda where they had this custom made kind of hand washing devices. And it's been interesting to see variants of that, kind of locally made hand washing stations around the world. So that's just one example of how people have begun to evolve into being conscious and aware and, taking charge of how they can deliver hand washing directly to locals. So that's interesting for me. I love that photo. It's in a bus park somewhere in Kigali. And it's happened that way everywhere. More people are conscious about their physical hygiene. Now, coming to my space, sexual health care, when it comes to things like HIV testing rates are still pretty low in a lot of countries, in a lot of villages. People still think you have to look a certain way before you can have HIV. So just before the pandemic, I'll say HIV self-test kits, the oral kind, became available in a lot of countries. So it's been interesting not only to be at the forefront of, creating awareness about usage and HIV self-testing, but also seeing the uptake, seeing that more people are becoming aware. And as we say everybody has a status. Do you know yours? So it isn't about finding out whether you're HIV positive or whether you're HIV negative. It's about knowing your status so that you can do the right thing. Do you have a high blood pressure? It's about getting checked. so that you can know what you have. So just know your status. Everybody has some kind of health status, some kind of health index. So that level of self-care is what we're kind of pushing. And we've seen it also when we began pushing cervical cancer screening and vaccination. Those conversations weren't even happening at all amongst at least most of our target audience. A lot of people are still surprised and they say, oh, you can get a vaccine that could potentially prevent cervical cancer. But even before they get to that stage, there are people who are still saying, oh, what is cervical cancer? So here's where the conversation around sex, like education, health education even comes to the fore. Like, it's been very valuable and very important for us to like collaborate, get a doctor. So it's not just like my organization talking to people. We always get like an extra person, a guest to come on board and enlighten. And it's been a powerful movement, not only within the sexual health space, but I see this going on, whether it's with COVID vaccination, whether it's with like, there's an overall, like an overarching increase in people's interest in being educated about their health. So it's tapping into that interest and kind of ensuring that the information that they do get is good quality, it's accurate, and the use of digital media to kind of spread that information. So we aren't just talking to someone in the city anymore. We're talking to someone in a remote village. We're talking to someone in Nasarawa. We're talking to someone in Ghana. And we're a business that's based in Nigeria. We're talking to people all over the world. We're having guests. There was a doctor from the UK come and talk to us. We are also understanding how, how the dynamics are in different parts of the world, how easy it is to get contraception in Nigeria, for example, but how hard it is to get it in the UK. Someone in the UK is telling us she's on a 3-month wait list. I'm saying, oh, I can book you the next day. So sometimes it's even those differences and understanding all of that has been, very important, so to say. What was the question?
No, you've answered it so well, Monica. I mean, just having to hear about how you're spinning all of these plates, that you can't just be limited to your city, that you're trying to globally help people and figure out when they don't have access. But I mean, it highlights a couple of things. It highlights, number one, how resourceful you are. And number two, why do you have to be so resourceful as just, one woman? And I mean, Daniella, that leads us to the next question, which is how can we get more resources to the people who don't have access to them? I mean, Monica can't do it all alone. How is it possible that in the UK, there's a 3-month wait for birth control?
Yeah, look, so I think these are really great questions. And, a lot of what we're highlighting here is a bit what I talked about earlier, right? The solutions sometimes are not about really sexy new technologies, but it's how do you transform policies? How do you work together, private sector, NGO, community, and the government all coming together, right? And this is where I do go back to that, 360 approach for collective action. I spent about a decade working with NGOs and working with the government. And what I kind of took out of my tenure for that is that where I saw the most powerful impacts that were at scale, that were rooted in community needs, that had the potential to really transform health, it was in things like public-private partnerships, for example, around HIV/AIDS with PEPFAR. It's everyone kind of working together in a 360-degree approach that meets people where they are, by the way, and really working together to drive collective action. And I think a bit of this also starts with trust and really understanding, health is so personal. It's about the human, it's about the individual. So really understanding the needs, understanding the barriers, and creating very practical solutions to help break through those. And then working in partnership across sectors to take those things to scale in a way that's sustained and really to ensure that we're also getting resources to where it's needed most. And I think that also gets back to, Mariniki's example, right? There can be oftentimes, small hacks that you can tap into to solve some of these challenges. And it just takes thinking a bit more 360 and how do we all work together around that?
Lisa, that leads me to something that I think that maybe people who are listening might be struggling with the difference. Well, I guess just how do we combine self-care and collective care? So self-care, and I think you touched on this, Lisa, we do have a tendency to think, well, that's selfish. I'm taking time for myself. If I'm taking time for myself, I'm not helping somebody else. But of course, we have to, I think, start to see these in a more integrated way. How do we do it?
Yeah, I can't agree more with what Daniella has said about this notion of this collective partnership and multi-sectorial, because everyone has something they can bring to the table. And as I mentioned before, in order to be a part of a partnership, in order to be a part of trying to help your community, you need to take care of yourself. And so I think part of it is giving yourself that permission to say it's okay to take care of me. And that's really important too. And so prevention is the key. And so when you've got the strong champion who has helped to take care of themselves, then they are energized and have the ability to really help mobilize others. And so I think there's room for both, and it's important that we have both.
Scott, what are your thoughts on this of self-care and how we should think of it? And for people who tend to think of taking time for myself means I'm not there for my kids for those couple of hours. How do we change that thinking?
Well, we have to reframe it in a way that it collectively is better, both individually and for society. And I think what was mentioned by Daniella earlier, that 2/3 of medical information or health information is not accurate. We need to help build a trusted source that helps people make these decisions independently where they feel it's a good thing. Two, that we know mental health, even now we bring in the workplace, we know that if mental health increases productivity and increases or decreases absenteeism, has people more focused, it's good for business, it's good for society, and it's good for families and so forth. So I think it's a framing issue in many of these. And we have all these roadmaps and blueprints in all respect to our great institutions, and we know that informed opinion and active cooperation will make things better for society. We know that we've got these ideas that are in place, but getting there, I think, Alisyn, as you mentioned, is going to be difficult, and it will take an investment. And framed at the local level, we need to reward for healthcare. I think you also mentioned we have a sick care system, not a healthcare system. So how do we keep people healthy? And healthy is more with self-care. And I think there's other ways of where people get health. One, it's the media, number one. Two, unfortunately, I say that with some of the misinformation on social media today. So the media is the good media, if I could say, the mass media, the news media, where people go to their first source. But then the other places, when people go to physicians, it's rare, I think you said at the beginning, less than 15 minutes, probably on average. So we also need to have those other intermediaries that are in place, whether it's the CVS Health, whether it's the trusted community leader or faith-based or someone who we're working with in school. So we need to move it out of the health care, so-called sick medical system, into the individual. And I think that's what the self-care readiness is about. It's about moving to a place where we can have individual action that becomes collective, to know our numbers that we spoke about today. And basically 75 to 80% of both just our behavior, what we eat and do, and how we act and interact is what's going to help us for our longevity and living well of a quality life. So we need to help focus upon that, and also, still not underinvest in the rest of the system, because I totally agree. Both modern contraception should be available to every woman in the world who chooses, and we also have the opportunity to use the resources of the U.S. government and the global governance system to help make health more equitable around the world. So I think it can be done. Keep the optimism of make the world better by 2030, but we know it won't be that much better if we just give up and only focus on what we've been doing today. Today in the world of COVID, much more self-care, much more well-being. So I hope that answers it. I think it's a framing issue. I love to see, as I said, the most trusted sources in news and other media continuing to promulgate the self-care and opportunities for us to make good, healthy decisions.
Look, I really appreciate you saying that. Obviously, we're fighting a battle every day against the deluge of misinformation. There are so many places on TV and online that call themselves news organizations or masquerade as news organizations, but they're not. And it's very hard for people to figure out where they can get trusted information. I mean, we're just all fighting it, as you know, right now. So I mean, just very quickly, and I do want to start taking questions in one moment from the viewers, because I know they have a lot of questions for you. But I'm so glad also, Scott, that you brought up mental health. I think that everybody needs to see that as real health. You know, like we separate it. Well, there's health and then there's mental health. And I just know that, you know, just speaking personally, I mean, I left a job 6 months ago that I loved, being the morning anchor for CNN of the morning show here. I loved my coworkers, I loved my job, but I meant, in terms of mental health, I needed more sleep. It was hard to get up at 3 a.m. every day, and it had all sorts of, you know, that took a toll on other aspects of my life. And so I made the choice to do it. And I think that people need to understand, you know, self-care does sometimes require some sacrifice or some, I guess, responsibility and tough choices, but it pays dividends, you know, once you do that and make the decision to do that. And we have to kind of give ourselves permission, I would say, to do that. And so Daniella, what are the takeaways here for everyone listening?
Look, I think one of the takeaways as we go into questions is that when we think about healthcare, we really need to reframe the way we think about it, right? Healthcare should be a continuum of care, and preventative care plays a major role along that continuum. And that's also where we see a lot of the self-care efforts coming in, right? So I think this is critical, really building awareness, rethinking our concept of healthcare. So much of this is about personal health. We've all had to self-care in the midst of the pandemic. And I think now there's a really critical opportunity to reframe not only the way that we think about healthcare, but really to lean into meeting people where they are. How do you empower people to work on prevention, to protect their immunity, and then by extension also to protect their communities? So I think we have a key opportunity here. And I would say to the audience, right, if you've learned something here today about what self-care is, or how you've been empowered to really take care of yourself, please share it. You can share it through #HealthForAll. We'd love to hear about that. And look, I think as we wrap, health is a human right, full stop. It's a human right. And we really need to make sure that, all people are empowered and know how to take care of themselves, and that we're meeting them where they are.
Okay, I want to get to the questions from the viewers now. So whoever wants to answer this one, this is out to all the panelists. So anyone who wants to, just raise your hand. This comes from Joe, and Joe was asking, how do we improve humanity's relationship with nature, meaning in terms of climate change, which is obviously causing all sorts of other health problems in terms of mental health, physical health. Does anybody have any thoughts on what climate change and the pandemic has created in terms of our relationship with the earth?
So maybe I'll just kind of kick us off here, right? This to me, I think, is a really interesting topic, because you can't talk about human health and not talk about the environment. Human health and the environment and climate are all linked. I think we all know the role that social determinants of health play in not only, the health an individual has today, but in the health over their lifespan. So when we see things like increases in floods, in fires, we know that in often cases, those are, disproportionately impacting underserved communities, and the ripple effects of already that climate change and a lot of the extreme climate events we're seeing have on these communities also kind of perpetuate cycles of poverty. They perpetuate a lot of the challenges we've talked about in terms of the resilience of healthcare systems. So when we talk about climate and human health, for me, the two are completely linked.
Yeah, that's really helpful. Thank you for framing it that way. Here's a question from Sadish, who says, there's a huge gap, and I want to pose this to you, Marinike, because I think you've touched on this, and I think that you know it really well. There's a huge gap between developed versus underdeveloped countries. With all of the facilities and information available, developed countries like the US, you see the US starting to ban abortion in some states. I mean, it's as though it's moving in a different direction, whereas underdeveloped countries are trying to get more options, more resources, then the US is going in this other direction. Do you have any thoughts on where we should put our energy in terms of that?
I think that it shouldn't be a contest, so to say, between developed versus underdeveloped countries. It should be the goal should be to strike some kind of balance. So healthy countries can help others. So looking at the abortion bans in Texas, for example, if that were to spread to other states in the US, it's going to in turn affect the US's ability to kind of help drive abortion access in other developing countries. So I don't think we should see it as a competition, rather see it as another important thing that needs to be addressed without losing sight of the effort and the progress that's currently ongoing in many other countries around the world. So I'll give an example, again, the UK example I made, where, and it's happening in a lot of other developed countries. So it's that kind of, irony where it's now easier to access contraception in a lot of developing countries and it's getting harder. Sexual healthcare is no longer prioritized in so many countries unless you are, say, maybe underaged. Your sexual healthcare needs still exist. They're still valid. Your ability to, seek sexual healthcare should not be, shortened or limited because you are past a certain age. But I'm beginning to see that happen in a lot of developed countries where you are kind of told, come back later for months and months. So I will say we shouldn't see it, to come back to the question, we shouldn't see it as a contest. Fighting bans against abortion in the US is very important, and it shouldn't completely steer the focus away from all the good work the WHO, Planned Parenthood, and so many social markets and organizations and work that people like myself are doing in developing countries across the world.
That's such a great point. We can do both. We should have the energy and focus to do both. That's really great. Next question comes from Matthew. Alisyn, I think go ahead, Monica.
No, I was saying, and there are people who are willing to do both. It's not like there's a shortage of people, and in a sense, maybe there is some competition for resources, but there are people on ground who are willing to do the work.
That's great. That's really hopeful. Okay, next, I think this is a good one for you, Lisa. This comes from Matthew. Whose responsibility is it to improve or increase health literacy? Healthcare workers, educators, government? Any thoughts on that?
It's all of our responsibility. It is all of our responsibility. And one thing we have not explicitly mentioned on our discussion today is the issue around the public health system. Public health, our patients, if you will, are the population as a whole. And so we need a strong, robust public health system. And that's been eroded over the years. And part of what happens in public health is really around health education. And so we have partners in communities, in schools, in businesses. And so we need to infuse this notion of health literacy in all of these different sectors. And so that it's everyone's responsibility to share the important messages, because people hear things differently from different persons. So you want the accurate information from trusted messengers to be shared. So it's really all of our responsibilities. And I think when we think about the system to improve education, to improve health literacy, to the degree that we can infuse public health professionals in businesses and can infuse people who have specialized in preventive medicine and public health into all of these different sectors, then that's going to strengthen the overall system. So we have individual responsibilities, we have organizational responsibilities to access the information, to ask the questions, and really to ensure that we all get as educated and informed as possible. And it's really important that we start with our children early on in the the different environments in which we have contact with our young people.
So let's end on this note. Let's go around, and if you could each just give us one action item that we can take away from this important conversation that we can put into action in our own lives today. Daniella, let me start with you.
Yeah, so if I think about our conversation around self-care, right, we can all self-care. We know the things that work, healthy diet, exercise, getting engaged with our community. So I would say all of us really giving in to self-care in a positive way, and really thinking about it in terms of how we also collectively help our community is actually by first caring for ourselves and focusing on self-care, increasing our immunity and things like that.
Excellent. Morenike, what do you want people to take away today?
Okay, sorry, I was muted. I want people to begin to look within their own systems and look at how they can make customized solutions. So there's a broad solution, yeah, but look within your own systems and say, okay, this is what could potentially improve self-care or improve preventive health care within my society, and support it. Support it through campaigns, through education, through digital health access, but let's all look inwards, recognize that there isn't a one-size-fits-all kind of approach to each society and each country, and adopt what will work for us.
Excellent. Lisa, what's your action item for everyone listening?
Two things, actually. Number one is that, again, the pandemic has showed us all of the inequities that exist. And so an action item for many of our businesses and our governments are, what are those policy changes that should be put in place to help address the underlying issues that have led to the inequities, so that we can truly reach equity in our country in terms of health outcome. And then the second is to just encourage everyone to practice prevention, that small steps can lead to big rewards. And so the small things, make the appointment, take that couple of minutes, make the phone call, schedule your preventive services, reach out to your local health departments or other community centers to find where you can get those clinical preventive services and take that action to take care of yourself.
You'll never regret that. You'll never regret that you took extra time to prevent something. I only hear people regret that they didn't. Okay, Scott, what's your action item for people to take?
And I would agree with you, Alisyn, on that. I think it's how we frame this. We need to frame self-care so we all feel comfortable about, we've talked about physical health, talked about occupational health, intellectual, what you're doing is meaningful, social, spiritual, emotional, putting all of these together. And I think framing it in a way that we could say we're passionate about it, so it's both a mover to action with the passion, but also economic incentives and nudges, and there's a whole array of ways of really not realizing that health literacy and self-care is not the system, but it's about yourself and your individual, and the system needs to simplify and give us those opportunities. So we can frame it together, passionate about it as we all have been on this meeting today, and hopefully have moved to action all together with inclusiveness and innovation, and create these opportunities to carry forward a healthier world.
Well, I feel inspired. I really appreciate having this conversation with all of you and all of you taking the time. So huge thanks to Daniella and Morenike and Scott and Lisa. This was really eye-opening and I hope inspiring for everyone who is listening as well. So thanks to all of our participants. Thanks to all of you who joined in to listen. And I hope that you too understand that together we can impact the future of world well-being. So we can act individually, we can act collectively, and it's going to take all of that to change the trajectory. It starts with each and every one of us. And also, of course, continuing to raise awareness about self-care. So please, if you have more to say or questions, use the hashtag hashtag health for all. Health for all, and we can continue that conversation. So again, thanks everybody. I really appreciate being with you all today.
Thank you.
Thank you.
Yeah.
Thank you. Bye.